According to medicinenet.com, physician-assisted suicide is the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. Physician-assisted suicide is the practice of providing a competent patient with a prescription for medication for the patient to use with the primary intention of ending his or her own life. This today is why I am saying that physician-assisted suicide should be illegal in the United States. According to CNN.com, physician-assisted suicide is legal in 4 states and 1 county of another. It is legal in Oregon, Washington, Montana, Vermont, and in Bernalillo County of New Mexico. Since 1997 and the legalization in Oregon, there have been 1,173 prescriptions written and 752 deaths recorded. In Washington, since the legalization in 2009, there have been 549 prescriptions written and 525 deaths. Since May of 2013 and its legalization in Vermont, there have been forms for 2 people, according to the Department of Health. My first reason today that physician-assisted suicide should be illegal in the United States is the pressure that it puts on the individual that is suffering. There is pressure because it would be much cheaper just to take a pill to end your life instead of paying for all of the cost of healthcare that it takes at the end of the journey of life. They may think that it is doing their families a favor by saving them money and just not to put the pressure on their families and just to take everything off of them. And it is almost as it is a duty to die instead of the right to live or the pleasure to be alive. And also, it becomes socially acceptable. When suicide is acceptable in one area, it seems to trickle down and become more common, and that's not something we want to do, is to take away the quality of life and the value of life. Also, psychiatric evaluations are not legally required by law before the administration of the suicidal drug. This is found at suicideisalwaysatragedy.org. A patient may be going through depression because of their illness or other types of psychiatric conditions, and because it is not legally required that psychiatric testing is done, they may be going through the depression or other types of symptoms that the doctor may not even see, because they may put on a front in front of the doctor and he may not even know. So they may feel that suicide is simply the way out, and it's not. My second reason of why physician-assisted suicide should be illegal is because doctors make mistakes. It happens all the time. According to Jane St. Clair in 30 Logical Reasons Against Assisted Suicide, the Journal of American Medical Association, Volume 284, Number 4, medical errors may be the 3rd leading cause of death in the United States at 225,000 deaths per year. One half of these are medical mistakes. 2,000 are from unnecessary surgeries. 7,000 are from medication errors in the hospital. 20,000 are other errors in the hospitals, and 80,000 are from infections in the hospital. If you ask someone that works in hospice, I'm sure they can tell you of a time that they have seen a turnaround. They're not probable, but they are possible. And to take this possibility from someone isn't fair to them or their families or the other people that love them. And giving this assisted suicide is taking this fight and this possibility out of their hands. My third reason today is that many doctors see that it is their moral responsibility to keep their patients alive. This is found at procomm.org. The Hippocratic Oath, the principles of the Hippocratic Oath are held sacred by many doctors today. On pbs.org found that the principles that are held by the Hippocratic Oath are to treat the sick the best of one's ability, to preserve the patient's privacy, and to teach secrets of medicine to the next generation, and so on. This is something that has changed from time to time. In the earlier times, the Hippocratic Oath was different, but even the modern versions still hold these principles, and it is sort of a slap in the face of this oath that these doctors take, and it takes the healer out of the doctor.